Thank you, Sela. I want to thank my colleagues, Moses Kamavale, Warren Wamala, and colleague from police. My name is Charles Solaro, the Director General of Health Services. The issues of theft of drugs definitely is a fundamental concern for Minister of Health, because as all of you know, health is wealth. So if there is any interruption on the supply and availability and access of medicines and medicine supplies, definitely it affects, it has got impact on the health service delivery, which definitely will have a bigger impact on the wealth of the country. The Minister of Health has sought to improve medicine's accountability and prevent medicine theft, improve monitoring of clinicians' outputs, but also improve on patient management. When we speak about theft, it definitely takes a number of forms. And I think most forms which we know is normally when you do with bulk theft of what? Drugs. But also what remains significant is what we call pilferage. It's where you keep removing small bits and small bits, and ultimately if you add those small bits, it becomes a very big amount, which definitely has impact. And when it comes aspect of service delivery, when you come in, it means that by the time the patient comes in, either is a mother to deliver, it means that the gloves should be there. If it doesn't, then it causes what we call the third delay. First, it probably has delayed from home, it has delayed to access transport, but also when it gets to the facility, again there's a delay because first of all there are no gloves. So we really, as a ministry, we want to thank this multi-sectoral approach where different government entities are coming together to address this, because the main person who is affected definitely is the health sector and me as a service provider. So to achieve this, the minister has rolled out the electronic medical record system in facilities as a digital tool for management of medicines and medical commodities. Currently, most of our facilities are able to order drugs from NMS electronically. So that has been addressed. But now what we need to address is the aspect of last mile, that how does it move from the store to the individual, and how do we account for it? So this system has been able to help us to promote this. We are on the early phase. So far we have rolled it over to 77 health facilities that are currently. And we started at the high volumes, all the national hospitals, the regional referral hospitals, 54 general hospitals, and also in a few health center 4s. So we seek that this will digitalize the all medicine management ecosystems. And if this is done, I would implore you, since you are within Kampala, you can visit the hospitals in Kampala, you can visit Kirudu and visit others, and you'll be able to see that you cannot access drugs if your information has not been entered into the systems. The other aspect which we think definitely also will be able to curb this is the new national Drug and Health Products Authority Bill, which is being discussed, because it has come with very strict penalties. So when this law puts into place, definitely the penalties, and as the funder has highlighted, definitely there will be a special court for those who steal what? Government drugs. So whereas we are waiting for that, I also want to take the opportunity to just indicate that medicine is not a solution for what? Everything. And I think that's here is prevention is what? Better than cure. So that the demand of medicine does not continue. So we need still to be able to implore. So there are many mechanisms which we can be able to do that. And I will want probably the members of the first estate, yourself, to start with that. How do you care for yourself? What we call self-care. And when you do that, then probably the need for drugs will not be what? Will not be significant. Why should you drive in a high speed and then get an accident, and then you say that you should get into a health facility and it become an emergency? So we need to be able to address that aspect. Issues of access, alcohol intake, smoking, nutrition and diet and exercise. So we need to be able to do that. So for the facilities which so far have not got these systems, we are encouraging that they continue with maintenance of stock cards and dispensing logs so that we can be able to track this supply and delivery of drugs. The last one which I want to mention definitely is that we have set medicine and therapeutic committees in our hospitals, and this definitely has been able to support these services at the facility. And then the other one which we are working with NMS and all the other providers is the issues of that how do we align our budgets, because also that we can order supplies which we do not need most of them. We need to order supplies which address most of the conditions which patients come with. So we are looking at the procurement plans, because government budget has progressively been increasing over years, and we need to be able to look at that do the hospitals put their money to buy things which patients need when they come to the health facilities. And we think that if this is done, then you will be able to see that you avoid getting expiries, because you have bought things which are not fast going, and probably you have wasted money. So as a Minister of Health, we want to call on the public that we have a very big responsibility to help us and to help yourself, so that we address this vice of drug theft, drug pilferage once and for all. Then we will be able to speak now from the ministry side, what is that additional resources which we do what? Which we need. But for now, definitely that if we don't close the tap, then the demand continues growing. So thank you very much for listening. Thank you once again. I think I had forgotten even my question, but now I remembered I have one question. It's regarding the guidance which His Excellency gave about issues of private pharmacies. I think I can confirm right now there is no private pharmacy in what? In hospitals. The pharmacies which are there belong to the what? Belong to the hospitals. Even if you go to Old Mulago, the one upside, on the upper side, it's actually a government, and the medicines are being provided for. It has been repurposed and is providing medicines for free. The last thing I wanted to comment was on the aspect of expiries, because sometimes it's very small things. For us, as when we plan that patients will do what? Come. Like if you take, for instance, you will have cases of hypertension in pregnancy. But if they don't come, then you will have this medicine and it will do what? It will expire. It's very difficult if your patient came and the medicine is not one. So we make sure that on the other side, but as Moses has said, that we limit that this does not go beyond 5% of the existing stocks. So First Estate definitely will play a very big role working with us. I think the securities here, they definitely will be able to take this some of the information in confidence, that we need to be able to address this challenge squarely. Because if we don't, it will be either, because it's a very thin line that we are here in this media center, the next thing that shall be the ones who are seeking what? Seeking this care. So we want to be able to put ourselves that when we need it, the medicines are available. Many things can be addressed. Let's be able to get this information so that we can be able to improve the service. Let's contribute to it. But as I did highlight, let's also be able to prevent those causes which will make us do what? Need medicines. Because medicine is not a solution. Because now everybody, even I'm sure all of you are consultants of yourself. You prescribe. You even don't do the consultations. So when you go to the pharmacy, you just say, I want this. We should avoid from self-medications, because we also running aspect of drug resistance. So the aspect that we shall have these medicines, but they are not working. So drug resistance is a very big aspect, which is a new epidemic which is coming, that what we sell antimicrobial drug resistance. So let's be able to work that we only take these medications when the doctors have prescribed, and when you are prescribed, let's complete our doses, because the other aspect again is that we don't complete, and then we expect them to work miracles. So these medicines molecules work, but only they work on specific diseases. So we'll continue to engage, and as a ministry will remain available and being able to see that we deliver what's required of us.